Now we look at two imaging characteristics. So these two characteristics are mostly seen in all those spine issues. So the called one, the sandwich vertebrae. So sandwich vertebrae, I think your vertebrae is becoming square. You understand? They'll have the other one known as the Roger Jersey vertebrae, where you're having alternating colors of white and what? Black. Okay. So let's look at the two of them. So first is the Roger Jersey spine or vertebrae. This other one is a sandwich vertebrae. So the sandwich vertebrae, you can see how the vertebrae is actually becoming square, and what the top and the bottom are very thick. You understand? So why the middle is actually, having less minerals. So if you are talking about the two of them, they're actually signs you see on x-rays, and the two of them actually mean different things. So sandwich vertebrae now, which is the second one, there's dense sclerotic end plate. That means the top and the bottom of the vertebrae is actually so thick. So central portion is kind of like less mineralized. So it gives the vertebrae the look of a sandwich with dense bread layers. Okay, so the middle has a lighter appearance. So causes is most of the times osteoclast dysfunction. So there's defective bone resorption. So you have bones are dense, but it's actually abnormal. So mostly is what osteopetrosis is the condition. You usually see that. So patients will have weak bones because the middle is less mineralized. Then it gives it a sandwich look. Okay, so fractures, anemias too, the rest of it. So what about the Roger Jersey vertebrae? So the Roger Jersey vertebrae is just sclerotic bands along the superior and the inferior end plates of the vertebral bodies. So central portion remains lucent. It creates an alternating sclerotic lucent sclerotic stripes. Do you understand? So at the end of the day, you're having something looking like what? A jersey, which is using Roger Jersey, right? So it's seen in other secondary hyperparathyroidism, excess parathyroid hormones. Okay. And most of the times patients usually used to have chronic kidney disease too, also renal osteodystrophy or any other metabolic bone disease.